Today it's my pleasure to bring you the story of a successful partnership, a story where three separate organizations came together to develop a fitness complex. This partnership, forged by the IBIS Group, brought together St. James Hospital, Prairie State College, and the Chicago Heights Park and Recreation Department, and created a fitness center that represented a win-win for the partners, but more importantly, for the community we serve. You may already know that the hundreds of hospitals across the country own and operate medically based health and fitness centers. In fact, over 600 centers currently exist with memberships of 1.2 million self-paying adult members. You may ask, why would a hospital get involved in the business of owning and operating health and fitness centers? At St. James, the answer is very simple. We care about the health and wellness of the community we serve. A health and fitness center also affords us the opportunity to help our community make healthy changes. Today, hospitals across the country are facing difficult financial challenges. New sources of revenue, like those derived from a health and fitness center, represent a light at the end of the tunnel. Medical fitness centers have been shown to provide a profitable retail revenue stream that is not dependent on the shrinking rates of reimbursement. In fact, more than 90% of hospitals in the United States with fitness centers are offsetting shortfalls in reimbursement with positive cash flow provided by these centers. The average medically based health and fitness center will generate a 15 to 25% return on investment. But despite these attractive rates of return, it's not always easy to secure the capital necessary to develop one of these centers. At St. James Hospital and Health Centers, we recognize the need for a comprehensive, medically based health and wellness center for our economically and culturally diverse community. At the same time, Prairie State College, a local community college, identified a need for a field house to expand its athletic programs, and our local Parks and Recreation Department in Chicago Heights wanted an indoor aquatic center to expand its family programming. Separately, none of us could have afforded what we wanted. Led by the IBIS Group, all three organizations working together were able to achieve our individual and collective goals. The spectacular result was a 64,000 square foot facility comprised of the following: an 8-lap to a mile walking jogging track, an aquatic center with a 5-lane, 25-meter lap pool and a large warm water therapy pool, a fully appointed men's and women's locker rooms with whirlpool, steam, and sauna, a heart-healthy cafe, a 15,000 square foot field house for basketball and volleyball, a cardiovascular equipment and free weights area, an aerobics studio, a children's center, and a physician timeshare space and cardiac and physical rehabilitation area. The ownership and operations plan developed by the IBIS Group allowed each group to achieve their goals. This plan also laid the foundation for the harmonious utilization of the center by all three groups. Importantly, pooling the resources of the three partners, creating sufficient capital to develop the center. From a community perspective, this partnership created greater accessibility and a variety of affordable ways for the community to utilize the facility. In order to meet the needs of our economically diverse community, we offered the community various options. Purchasing a membership in the medically based health and fitness center allows a member use of the entire center. Community residents can sign up for a specific program through the Parks and Recreation Department or take an accredited course class through the college. From our perspective, we've been able to expand our outpatient services, generate new referrals to other healthcare services, expand our potential patient base, all while creating a profitable revenue source. From start to finish, the IBIS Group developed this project, beginning at the business planning phase and taking us through the grand opening. They literally handled all aspects of the development process. With their help, our dream became a reality. This successful collaboration demonstrates very clearly how hospitals and other community organizations can expand their services and augment their facilities while greatly reducing capital and operating costs. By working together, a medically based health and fitness center became an important component in the continuum of care for our community.